folks, welcome back to another episode of the NYU GPH podcast. Today's guest has a background in dentistry and a master's in public health from Mount Sinai. Her work blends clinical practice with research and advocacy, collaborating with NYU School of Dentistry and global partners like the WHO. Today, we're joined with Kiran Nagdeo, a PhD candidate at the NYU School of Global Public Health over here, whose work focuses on maternal, child, and oral health at both local and global levels. She also serves in leadership roles at the World Federation of Public Health Associations and the American Public Health Association, where she's committed to advancing oral health equity through interdisciplinary research, public engagement, and policy change. I'm so excited to speak with her and introduce her to all of you. Kiran, welcome to the IMGPH podcast.
Thank you.
We're so excited to have you here. And I mentioned the word dentistry to start us off, and the word, what dentistry even means. When you think of public health, there's so many things, doctors, injections, things like that. Your public health journey started with in the world of dentistry. How did that even happen?
So I was a clinician in India, and I practiced for 8 whole years. I never thought I would ever have a non-clinical background, but here I am. It all started with COVID. While I was practicing, it was all with a doctor-patient relationship. So it's very one-on-one, very individual level intervention. But unfortunately, when COVID hit, we were all in lockdown, and there was absolutely no way that I could have helped someone with the skills that I had at that time, which was purely clinical. When I realized if I had the skill set, I probably could have helped a lot more people, and probably a lot more introspection and personal reasons that ended up me choosing to go down the route of public health. But I absolutely love dentistry. So that's why my public health focus is also a lot more on oral health, global oral health, and if possible, somewhere down the line, clinical dental data as well.
What areas did it perhaps take you into? So you had like a very specific thing you discovered in the world of dentistry. And then how did it create how it took you in the future and forward when you went into your public health journey?
So when I started my Master's of Public Health, I guess it was very broad to begin with, which is what I wanted. I was very siloed with the clinical dentistry, and I wanted to understand public health on the broader horizons. And it did not have any aspect of dentistry when I started at Mount Sinai.
Oh, wow.
Because it's a school of medicine and very focused in that area too. Not like NYU, which is a big university and has many schools and colleges within it. So my focus then shifted to a lot more of environmental health, environmental justice, a little bit of maternal and child health on the global level. And those were my projects and things that I pursued. I tried my best to do a lot of extracurricular activities that involved oral health, so within APHA, which is American Public Health Association, and then I joined the World Federation of Public Health Associations as an intern. Eventually, I grew in that area, but the internship was in the oral health work group, and that opened up a lot of doors for me to finally pursue my one of my major passions, which is oral health.
So it started from somewhere. It kind of went nowhere when you were like, "What? There's no room for dentistry over here" in the beginning, and then suddenly that passion came back later on. I have a very I'm interested in something. You mentioned it very casually about the organizations you interned at and you worked with very casually. It's hard work to get into those organizations. I wonder what you did that someone else could also do to find that path during their MPH.
Thank you for asking that. The reason being, I think a major factor was luck in my story. So I was involved in the student council at Mount Sinai, and there is something called as a Jacoby Medallion Awards that happen every March of every year. And I got a free ticket, because it's at the Plaza Hotel. You don't usually get tickets there. And I went there and met Dr. Emma Ben, who is an amazing biostatistician and is in the population health department at Mount Sinai. And she's like, "Why don't you tell me about you? I would love to know what you're doing." And I got a chance to share a little bit that I'm doing my MPH. And she said, "Why don't you reach out to me?" And she introduced me to Dr. Haewon Lee, who I credit most of my successes to, I guess. She met with me before she moved to Korea, and she was a pediatric dentist in Mount Sinai. And that's how I was able to apply and get into the World Federation of Public Health Associations, because she was the chair of the oral health working group. She mentored me throughout the whole thing. I've had a very exponential growth under her. Even though this was an informal mentorship, she really helped me grow. Because of my internship and because of her, I started working on a scoping review, which was on maternal tobacco cessation and prevention. That led for me to apply or submit an abstract to APHA, which is where I met her again and gave my first ever national level presentation, a poster presentation, and got involved in a lot of different sections. I am very active with the maternal and child health section and oral health section, and also hold leadership positions within the student assembly. But that's just me trying to be active in these areas. It just depends. If someone's interested in it, reach out to these sections and tell them that you're interested. And they will always be happy to have students come join them.
I mean, can you explain to the listeners how crucial it is to have a mentor?
They'll speed you up, speed up your progress a lot faster and take you to greater heights, I guess. And I wouldn't have known anything about APHA or submitting to conferences or even doing my PhD that ended up happening later on. It's these guidance and advice that I've gotten through my mentors that has helped me. I was very new into the world of public health. I had not had any research experience before this. So from scratch, it is my mentors at Mount Sinai, my mentors, Dr. Haewon Lee in the Federation, who actually helped me grow in this new area because I showed some interest and they helped nurture it.
I find it interesting how your interest was evident to them and they brought you on because of your interest. You didn't really try, you showed up and you simply did your thing. You spoke to them without any intention and you got mentorship as a byproduct.
Actually, you put it perfectly, and you mentioned a very important point that people should always consider. A very crucial point in anybody's life is showing up. It's just finishing my class and leaving to go to the Plaza Hotel at the last minute, and me showing up ended up with me being where I am today. So showing up is a huge part of wherever you want to go. With that, if you do express interest in people's lives and what research they're doing and where you want to go, there are so many people and so many mentors out there who want to help you. I hope that one day I can give that back as well at some point of time in my life. But there are so many people who will be happy to help you. And the one thing that we need is just reaching out and showing up.
And I'm sure someone after watching this would also feel like, I could probably reach out to Kiran after hearing about your journey.
I'm happy to help. That's my tagline, happy to help.
Happy to help indeed. Now, help us understand this, Kiran. What was the journey to NYU like? How did you even end up here?
Thank you for asking that, because it was a very crucial decision when I was close to completing my Master's of Public Health. I thought I would want to work for some time, but APHA, where I met Dr. Lee in person after such a long time, she's like, why don't you go ahead and do it? And a lot of other mentors that I'd met along the way who also had the same advice to me. Why wait for a PhD if you want to do it? And you can always work after. So it's funny if I can share this. After APHA ended on November 15th or 16th. I reached back home and the deadlines for the PhD applications was 1st of December. So I had to whip up my application in 2 weeks. And I still can't believe I'm here because it was just 2 weeks of really intense hard work to make something come up and requests to all my mentors for their letters of recommendations. I always wanted to do a PhD. There's 2 reasons to it. One was that I was inspired by a teacher back in school, even though she taught the Hindi language. This was when I was in Saudi Arabia, and she had a doctor. She always signed that. She had a PhD in Hindi. And I was like, that's really cool. You can become a doctor like that. What I did not know back then is that I would become a clinical doctor eventually. And so I never had a plan to do a PhD for a very long time. So probably that has shadowed my decision in some way. And the second reason was that when I came into the world of public health, I really enjoyed research. I really, really did. So I knew I wanted to do this for a very long time in my life, pursue it further. And right from my first year, if somebody asked me what I wanted to do, I was like, I definitely want to do a PhD. So that was how it happened. 2 weeks worth of applications and then a lot of praying to get into NYU because it was my first choice.
I mean, it seems like it got you to the right place, and it's fascinating to see how you just did it in 2 weeks. You thought of your Hindi teacher back in Saudi, a Hindi teacher in Saudi Arabia that's a doctor. That's so fascinating. Ho- Now that you're here, how has this place helped you with your projects? How have your interests changed? How does NYU support you in your journey?
There's a reason it was my first choice. It's because I kind of spoke about how it being a bigger university and it has many schools and colleges under it. So I was very lucky to find collaborations with NYU College of Dentistry, and we've been doing that. But before that, I'm very lucky to have a very supportive mentor here, my PhD advisor, Dr. Andrea Dearline. If she didn't allow it, I couldn't have pursued my interests so deeply or with as much confidence that I have right now. So I reached out to quite a few people in the College of Dentistry, and I've been able to work on a few projects with them. So I don't think that was possible if I went elsewhere. And I always wanted to stay in New York. So NYU always became my first choice. And I'm here and I'm happy.
For a student that might not know about NYU or is interested in coming in, what could they be looking forward to when they come here, and what might be some misconceptions about being here at NYU?
Because I had some time in New York City when I was studying at Mount Sinai, I realized the amount of opportunities that opened up for me. So I wanted to keep that momentum going. And that's why NYU became my first choice. I wanted to stay in the city. The city has a lot of opportunities. New York University has a lot of opportunities. You have a great support system, which I really appreciate here. Being an international student, you have the Global Services Office, which has really been supportive towards all international students. And I've had a very different experience, which I'm happy with. So if there are any international students, I think this is a good place.
Wow.
There are student life things at NYU, which comes, I guess, with a big university. We have a whole building of a library. You have a whole building that's for student life. I'm enjoying it, and it has a great view of Washington Square Park. I'm a tourist at heart. I love traveling. So this is one of those things. But beyond that, you have some great academicians and absolutely lovely people who are there to help you, people who will have you on their research projects. And if anybody's main focus aligns with the university's professors and their research interests, they should not hesitate coming to NYU. I think it's a great place to be at.
Speaking of research projects, what projects have you stumbled upon when you came here to NYU? What's in your radar right now doing your PhD?
There's just been a few because it's only been my first year, but a couple of them are in collaboration with the NYU College of Dentistry. As a PhD, our first year benchmark is to do a systematic review. And that's something you have to do from scratch up until the end. And if you wish, you can publish it. So mine has been with Dr. Habib Benzian, who is the director of the WHO Collaborating Center for Oral Health. And I think it's the only one in North America, if I'm not wrong. So I was very lucky to get an opportunity to work with him on this, which is something called as a PUFA Index. It's a way to measure untreated dental decay and record them in studies, epidemiological studies. So we're just trying to systematic review basically is trying to find out how it's been applied since its inception in 2010. And Dr. Benzian and Dr. Monse, who are on the review with me, they are the ones who developed that index with others. So it's been pretty crucial for me to have started off with such a good project. And it's been going well. One of them is this, which all of us will be doing. Hopefully, I will be publishing it. Then there is one study with the chair of the Department of Epidemiology at the College of Dentistry, Dr. Fernando Hugo. We're working on an NHANES paper where we're looking at ultra-processed food consumption, dental decay in pregnant females. So we're taking some data from NHANES, which is a national data set and publicly available. Anybody can do this. And then we found that people who have consumed more ultra-processed food have actually had a higher incidence of caries. With that, I am also working on a qualitative arm, which is sometimes unusual for epidemiologic students and professors or epidemiologists to do. But this is important to me because I had a little bit of a background during my summer research project in global health with Mount Sinai, where I went to Rikers Island and I worked with Elmhurst, New York City Health and Hospitals in Elmhurst. And there was a project on birthing support for pregnant females who are incarcerated. So that allowed me to go and meet with them, shadow a bit with the delivery team, with the care delivery team. And then also I got a chance to shadow the dental team there. So I've always had a little bit of an interest in serving the underserved populations, I guess. And here with the policing project, it's a similar situation. You're looking at substance use and trying to find, there are alternative response teams for substance users, I guess. There are alternative response teams. Instead of calling 911, you can call them and they will help you if you have any substance use problems. So that's the part of this. And there are 4 cities involved in this. Right now, we've started working on this and figuring out how effective they've been. So that's the qualitative arm of my work here.
Can you help the listeners understand what qualitative is? Because we keep hearing about quantitative oftentimes, which is numbers and data.
Right.
How would you describe qualitative?
Yes, there's quantitative numbers and data. Qualitative is about your experiences, your perspectives, and it involves a lot more of this, the interviews. It involves focus group discussions. It involves different kinds of methods. There are different qualitative methods. But basically, it's just to record what your perspectives about a certain issue is, what your experiences are, and that helps inform, or let's say these are soft data and quantitative is hard data in a way. And many times, this is something that I've seen many times, a lot of soft data is ignored when you talk about research. Hard data is always more valuable. But it shouldn't be that way. People's experiences and perspectives are equally important, and it can help inform a lot of policies. So that's where qualitative methods and qualitative data come into picture. So you analyze them based on excerpts of people, what they've spoken about, how it can be helpful in shaping up your study and informing those that will read our papers or informing policies and making some change eventually.
I'm blown away by how you're telling me before you joined an MPH, you never did research, you never did any of this data collection, you never did worked with people like this, and now you're doing such specific projects in multiple projects, not just one, not multiple projects over the years. I like the idea of how people do research. What was very fascinating to me when learning about you before you came on the show was you have actually put this into practice where you are gathering data, you are doing qualitative and quantitative research, yet you go into the field, you're applying it. What has that experience been like for you?
I'm actually trying to. The end goal is always implementation.
Nice.
There is absolutely no point to research if you cannot implement it. It's just going to be a lot of publications. It's going to be a lot of papers for you, and that's great. But what about it then? So if you can't implement it, there's no point to research. I have not been the best at implementation yet, but I am trying. I'm learning how to do that. I think one of the efforts is going to these conferences and having a voice, especially because oral health, because I have a background in dentistry, I care about oral health a little bit more. And that's why I mentioned oral health first. It's like oral health is really siloed on its own, and it doesn't have as much of a voice in public health as it should. So it's about connecting your mouth to your body,
Wow.
which is usually, it's a very common way for many dental public health experts to talk about how we want oral health integrated back into general health.
It should not be separate. It's like its own world. I see.
Right. But unfortunately, it still is very siloed. And so one of the efforts is like conference presentations, going to conferences and talking, advocating. And beyond that, one of the efforts that I'm trying to get more established in is the United Nations. So I'm a UN representative for a Geneva-based organization, which is the World Federation. And sometimes I do go during the United Nations General Assembly, although I am inherently an introvert, so I haven't spoken as much, but it's just showing up again. Showing up and making sure that there's a space for oral health organizations or oral health practitioners.
How does one become a representative? How did that happen for you?
I actually had two opportunities. I'm very lucky again. One was a New York-based nonprofit that was an ECOSOC member, which means they are, I struggle to remember what the acronym stands for, but they are civil societies that can be members of United Nations. And you have certain representatives that you can appoint to have a pass, like our NYU pass, and you can like go attend things at the headquarters. And again, I think we're lucky that the headquarters is here in New York City. But then there's another organization, which is the Federation, that also has ECOSOC membership with the UN. And because I'm based here, I think it made it more accessible for me to go to the UN headquarters and be a representative for the organization. So my involvement and volunteering in these nonprofit organizations helped in me getting that. So if there are people who either work for them or are involved in these initiatives and they are able to make an application to be an ECOSOC member, I'm sure if they show up, they can be a representative.
There seems to be a common theme of showing up that you have mentioned.
Yeah, I'm a big fan of that. I apologize.
You don't need to apologize. I think it's showing how important it is because you're very casually saying the opportunities that you're in, but they're really a byproduct of your hard work and showing up. You have an interest, you grab it, and then you're showing up to conferences again and again. I mean, you're doing a PhD right now, Kiran. You have so many papers to write, so much research to do. And I know after this, you're going somewhere after this interview. You said that as well. You're always showing up to places, despite being an introvert. Where does that inner voice come from? Where does that inner compass come from for you?
I think I changed when I came to America. I had to change. To survive, you have to participate a lot more. You have to show up. You have to be a little bit of an extrovert or change yourself. And I think I allowed that to happen in me. Sometimes it's difficult for many introverts to show up the way that I do, and that's okay. But I think I made too much of an effort to do that. I guess nobody would believe that I'm inherently an introvert at this point. But 3 years ago, everybody could believe it. So I had to change over time. You have a lot of opportunities if you can present yourself that way. Well, I want to make my parents proud. That's probably it. And I probably hope that that was probably it. That was my answer.
And that's beautiful. I mean, everyone has an intrinsic motivation of their own kind. And for you, it's your parents, making them proud and making sure that you do your best and to make them happy and joyous of your successes. I'm sure everyone listening to this has a different one, but it's more about finding your inner compass. What keeps you moving? What keeps you going to show up to do all these amazing things? That's awesome, Kiran.
Thank you.
You're only in year one of your PhD as we're recording this. And as we finish, I'm curious to know from you that what are you excited about next in your journey? What about the public health world really excites you?
Since I'm a PhD student in epidemiology, I want to do a lot more of epi. I know that I have so much more to learn. I'm very excited to learn everything there is to know about the epidemiology world. I am not the best equipped as of now. I know enough about the oral health world, and I did pretty okay in that world even after coming to America. I really feel epidemiology has more to offer. So I want to learn my methods well. I want to be able to do better studies. I want to know everything at the back of my hand, which I don't as of now. But I want to get there. I want to get there while I'm in my journey at NYU as a PhD student in epi. And hopefully many more opportunities here. It's a great place to be in. There's so many people within the NYU family that can present a million opportunities that I probably can't even think of at this point. So I'm excited to see what comes in my way while I'm here and what more can I pursue. I want to see how far I will go eventually.
Well, we can't wait to track your journey and we can't wait to see where you go because you're doing amazing work and it's impressive the amount of things you've achieved and the spaces you're in. Usually, my last question for you was actually to ask, what would you leave the students with? But if I were to leave all of you with anything from this interview, show up, show up, show up. Is there anything else you'd like to leave for the students out there, the future students, the next generation, the current students? What would you leave for them?
I think that's the perfect answer. Showing up is great. I also think we should talk to people a lot more. Do not be as nervous. Even if you are nervous, do it anyway. Go speak to people. Tell them about your interests. Someone might be there who might want to help you without you even asking. And that'll take you somewhere else in life. And you won't even imagine where the opportunities come from. So, well, I guess just really reach out and show up. I think those are the gist of it.
It's a beautiful place to leave everyone. Kiran, thanks so much for sharing your insights and your entire journey with us.
Thank you. Thank you so much for having me.
Our pleasure.
Thank you.
Folks, that's Kiran Nagdeo. Check her out around campus, say hello. And I hope that left you with a lot of inspiration because I'm certainly inspired to show up to my next thing. Take care, folks. We'll see you in the next episode.